Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Lee Acey, who's the director of the Mayo Clinic Social Media Network, which provides training resources, educational and networking events, and a collaboration platform for healthcare professionals who want to safely and effectively apply social and digital strategies to fight disease, promote health, and improve care. By night, Lee is Chancellor of the Social Media University Global, a free online higher education institution that provides practical, hands-on training in social media for lifelong learners. He's been inducted into the Healthcare Internet Hall of Fame, and Health Leaders Media named him to its list of 20 people who make healthcare better. Welcome, Lee. It's a pleasure to have you.
Thanks, David. I'm glad to be able to have this conversation.
So you have done so many things at Mayo Clinic in the realm of social media, and I'm wondering if you could kick off our conversation today by highlighting a couple of things that you've found the most rewarding over time in your work.
Yeah, so I think from my perspective, one of the biggest things is being able to make high quality, reliable information, in-depth information available to patients. So I was just overwhelmed with the opportunity that we have to capture that expertise of our providers to be able to, through YouTube, through flip cameras, through YouTube, and now through Facebook Live, as things have evolved, to be able to take that Mayo Clinic expertise and make it available on demand or live to people who are interested, who have serious health concerns, and to really extend the reach and overcome the geographic challenges that we have, being in the central time zone in a community of 100,000 people, right now in Rochester, Minnesota, the fact that we can literally reach around the world. I also have been really gratified by the ability to connect with others like you, people who are interested in healthcare and social media and technology and applying that in health and helping us navigate through the issues, the concerns. There's always, in a risk-averse industry, which we certainly are, there's all sorts of good reasons not to do this stuff. But the ability to find like-minded people who are believing as we do, well, there's got to be a way. We need to be able to figure out a way to make this work. That's been really exciting.
Right. It is important to find a way because, as you said, there's so many reasons why we should try to communicate with people beyond our immediate locale and reach people where they are. From my perspective, that's really the goal. You want to reach people where they are, and these days people are online, so that's where we need to be. That's where you need to be in order to reach them. Did you find that there was a lot of resistance in the provider community, and specifically in your provider organization, to begin this journey in getting online, getting into social?
Yeah, I think there was a lot of concern or uncertainty. I mean, it felt like something that was really new. So 10 or 12 years ago, when we were starting using social media tools, first with podcasting, then with getting into Facebook, that all felt really strange and foreign. And, it felt like, something really novel to be getting into. We made the argument, I think, pretty well and successfully, as it turned out, that these really were just extensions of ways that people have been communicating since the dawn of human speech. And certainly in healthcare, that social networking, whether it was our founders, the Mayo brothers, traveling to 25 countries during their lifetime to learn from others and to then invite them to come and learn from them, participating in these national and international medical societies, that essentially these social tools were just the digital way of making that same kind of networking happen, in the same way that the patient word of mouth had always been an important factor in people making a decision to come to Mayo Clinic. Well, now that word of mouth happens online. and it spreads a lot farther and faster. And so, some of what we did was calculated risk and understanding that for instance, our first podcast was just redeployment of our 60-second radio segment. So not an ideal podcast by any means. You want to have it be longer like this one is and more in depth because you're reaching that narrower audience.
Sure.
But it enabled us to have the proof of concept that, hey, we could make this thing work, and that there was some kind of appetite for it. And that over time, people warmed up to it, first of all, because they saw some of the really positive things that resulted, the connections, the ability to capture some patient testimonials, for instance, and to have those go viral, so to speak, that enable people to see that, this really isn't that much different from what we've done before. And just as we were doing media relations, we were doing interviews with patients with the appropriate consent form signed. Well, let's just do the same thing with the videos that we record and put on our YouTube channel when it involves a patient. And so the fact that there were opportunities to navigate, and without it wasn't a radical extension of what we were already doing, but more of a natural growth and natural application and applying the same principles, then it's not, then it becomes less scary. And then when you have some success come with it, it helps people to, again, be more accepting because they've seen the good that can come.
Sure. So part of what you've been talking about is really repositioning broadcasts, if you will, and using sort of a different medium or different sort of platform for outbound information, so to speak. And the social aspect of this, I guess, is the question is about the social aspect. Where have you found the best opportunities for creating engagement that can go in both directions? And do you see any particular area that's sort of ripe for further development in terms of developing engagement, whether it's type of services that are provided or type of employees within the organization that are sort of the best opportunities for building deeper communication?
Yeah, I mean, I think some of it, as you said, is we did a TV segment and we put it on YouTube, or we did the podcast was from a radio segment, and certainly there's a place for that. As the technology has evolved, and using the flip camera and being able to record and then upload, then you're able to go much more in depth in the information. It's still pushing out information, but then you get the comments coming back from it. But what's really taking it to the next step is when you can do live video. And we started with Periscope, but then Facebook Live came on the scene and has offered us, a lot more opportunity to reach a bigger audience. And Facebook, at least at first, was significantly favoring live video. I mean, when you get situations like that, and the gratitude that we experience from patients as they're able to ask a question and get it answered, and understanding that it's not direct medical advice for them, but the connection that they feel and being able to have some give and take is really huge. I'd say in terms of people getting really genuine and really more in depth with their connections, our online community that we've created called Mayo Clinic Connect, which is at connect.mayoclinic.org, has really shown itself valuable because people don't have to use their real names there. I mean, the one concern that people have on Facebook is that, all my friends are going to see what I'm talking about. And to some extent, while you use a screen name on Twitter too, it gets associated with what's your real name. People can go to our online community. We've got about 56,000 members right now. They can use a screen name. We still have good community standards and guidelines to prevent it from becoming spammy. But then people can really, connect with other people like them, and getting these patient-to-patient conversations to better understand coping with their disease or condition.
Do you end up monitoring those conversations and injecting other bits of conversation as well from the institutional perspective?
We do to some extent. So it's we have a pretty light hand on it, but we do have 4 part-time paid moderators who are there to read everything that's posted, and again, making sure that there aren't guidelines violations like pharma or device or others, or people's trying to sell some quack remedy, and to maintain those community standards. We also have almost 15, I think, mentors, community mentors. So these are people who have come into the community. They're the e-patients. They're people who are experts in their experience of the conditions, and they've also shown themselves to be good community citizens. They're people who want to help others, and so we've deputized them kind of officially to say, you're here to help welcome people to the community, help them make connections. Because so Colleen Young is our community director, and she sort of oversees all of this. But her role is not to be, we don't want to be heavy-handed with it, and she actually helped suggest that we hold back a little bit on saying, well, let's jump in with the physician with the answer to this, because that tends to quiet down the conversation. It makes it, okay, well, the doctor has spoken, so I guess we'll just let it go. But we do, at the same time, we have an opportunity to bring expertise, Mayo Clinic subject experts that a regular online community doesn't have. And so sometimes there's, it actually even wells up from within the community. Hey, what do the pharmacists have to say about this? So we have people who are able to provide some commentary when asked, and we have them do some of that. Sometimes we ask them and then interject it. Well, we talked to a doctor who's a specialist in this, and she said this. So there's some of that. We also have, we redeploy our live events, like our Facebook Live discussions, within Mayo Clinic Connect too. So simulcast, and then also archived there. So we call those video Q&As, and the live video events. And so on the one hand, we're gathering the questions in advance from people in the community who are already there. And then secondly, we have people who are participating sort of just because they saw something show up in their Facebook feed. And that tends to draw people toward a closer relationship with Mayo Clinic.
Great. If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Lee Acey, Director of the Mayo Clinic Social Media Network. Lee, what you've described just now is a whole variety of platforms and types of content. And it sounds as though you're doing a lot of mixing and matching, cutting and pasting, linking from one thing to the next. I wonder if you could say a little bit more about that. Is that a cohesive strategy to draw people from one web property to another? Is it a strategy to pull people into different kinds of conversations or present the opportunity to engage in different kinds of ways? Or is it just an effort to put all the content that might be relevant in front of an interested person? Is there a method to your madness?
There is a method, and the method has evolved over time. I mean, back in the day when we were on Facebook, so when we were on Facebook starting a little over 10 years ago now, anything that we post there would get pretty strong organic reach because Facebook was starving for content. Well, it was never starving, but it was looking for a lot of content. And so you could post something on Facebook and most of your followers would see it. I mean, that's what it seemed like anyway. There was a lot of engagement that way. And kind of likewise with Twitter. And you mentioned earlier about that, we need to be where the patients are, and certainly they're online, and certainly they're on Facebook, with Facebook having a couple billion monthly active users. We need to be there, and we need to be represented there, and that's an opportunity to make those broader connections. At the same time, the organic reach has declined over time to now where it's in that 1% to 3% range. And we've also heard some relatively recent news that, Facebook is experimenting with zero organic reach, and that, anything from brand needs to be paid. And so that's part of why I sort of call it sharecropping when you're on Facebook and Twitter and even YouTube to some extent, although I actually think there's a lot of SEO benefit around that. But we want to be where, we've got about 1.7 million followers on Twitter and 1 million plus on Facebook. And so it's great that we can reach, tens of thousands of people, even organically there now. But what we want to do over time is draw people into that deeper relationship we talked about, where that's where the Mayo Clinic Connect platform, the ability to have our owned community where people sign up for an account and we can send them an email if we want. And we don't just depend on the, and they get notifications of what's happening in these conversations. We don't just rely on the whims of Mark Zuckerberg and the Twitter founders to decide which of our posts should be seen.
Once you've drawn somebody in who wants to be a part of this community, then it's a lot easier to use your own platform for future engagement.
Exactly. And we right now we've got about 45 different topic-oriented groups. We start with them kind of general because you don't want to have a room of the house with nobody in it talking. So they started with cancer altogether, but then as you get enough people coming in talking about breast cancer, they deserve their own little room, and pretty soon that room gets big. But that it's beneficial to both, that you don't have one topic that does, dominating the conversation and then others aren't able or aren't finding it relevant. So over time, it was probably 25 groups at first, and now I think we're up to 45. And we just, again, look for a critical mass of people wanting to have a conversation. If we have a community mentor, one of those volunteers to really be the shepherd, that's really positive as well. So it's really based on, and so that's when you talk about the listening, it's like the fact that all these groups that have grown up have been because there were enough people coming together wanting to talk about those topics.
Right. So you've started with a significant advantage, Lee, of having one of the strongest brands in healthcare when you started to try to push this out through new channels and new media. In 2010, you were instrumental in establishing the Mayo Clinic Center for Social Media. And I'd be interested to hear you speak about the reasons for doing so and sort of how the changing landscape over the past number of years has affected the work done through that part of the organization. And I'll just throw in here, in the interest of full disclosure, I'm a member of the External Advisory Board of the center.
Well, we appreciate that, and that's actually part of why we did this, because as we had started with some effective media relations sort of applications of social media, and we had some success up front, we saw that there was an opportunity to help our colleagues at Mayo Clinic first, so those who are working in education, research, clinical practice, to think through how they might be able to apply social media in their work, just as we applied it in the media relations work. But then secondly, just in keeping with our organizational DNA, our founders were always doing that old analog social networking and outreach, and sharing and learning from others. And so we said, let's create a place where we can help to accelerate the use of social media in healthcare. And that's why we thought having an external advisory board of smart people who don't all work for Mayo Clinic but are interested in this too, we could create something of a movement and help provide support to our colleagues at other institutions who maybe hadn't had the opportunities that we had had, and how can we be a resource to them so that they can encourage their organizations to adopt these tools too. When we fundamentally understand the nature of Mayo Clinic, we've got campuses in Scottsdale, Arizona, as well as Jacksonville, Florida. But in addition, our original location is in Rochester, Minnesota, which is a town of 100,000 people, and we depend on good relationships with colleagues around the country, around the world for referrals, as well as then the patient-to-patient kind of self-referrals. So, when you consider that Dr. Will, one of our founders, traveled to Australia by train and by ship in 1924, we just said there's no way he wouldn't take advantage of these tools that would let him make instantaneous connections. And so because of that, we saw an opportunity through the network, again, develop resources for our colleagues who work at Mayo Clinic, but also then for those outside of Mayo Clinic to say, hey, if they can sort of ride along on our push, if they can take the resources that we've developed and use those as starting points for developing their own guidelines or for their own training programs, then that's just the right thing to do, and it ends up, we generate a little bit of revenue too that helps us do more of this kind of stuff. And it's been neat over time to see that we've had people from as far away as Australia, New Zealand, the Philippines, various places in Europe. We've had a member organization in Kenya that, to make these kind of connections that never were possible before.
Right. So, it has been a while. So I'm wondering what sorts of changes you see over time in the use of social media in healthcare, the needs of members of the network over time, and sort of the appetite for the for this sort of content and this sort of media among the general public.
Yeah, I think, just as the growth of Facebook, for instance, to be 2 billion monthly active users, where Twitter, when we started, there wasn't a hashtag in every ad or in every Super Bowl, every Super Bowl ad or every television reporter didn't also have a Twitter handle. It's definitely become more mainstream, and people are just seeing this as the way that they communicate. And so I think the way things have evolved over time is that the next phase is to get much more specific and concrete in some of the services that we offer. One of the groups that we're excited about working with is our Mayo Clinic nursing department. So they're 20% of our employees, and we see an opportunity, and they've seen opportunity when we're looking at recruiting the next generation of nurses. And as we have so many that are approaching retirement age, that from being an employer of choice to just helping to create connections across the enterprise, there's a huge opportunity there. It is the technology is changing, and we don't want to get too tied up in the specific. Well, we want to provide specific details on how to use the platforms, but on the other hand, we want to mainly find the real practical applications within different segments of healthcare, I guess, to be thinking strategically about how do we use these tools to accomplish our work, and how do we use them to accomplish strategic objectives for the organization. So I think that's something that we're seeing across our external members too, that they really see that these need to be applied with a business approach, with what is our work to get done, and how can these tools help us mindset.
Sure, it's a real combination of dealing with the specific details of particular platforms, and also more generically at a higher level, thinking strategically about how to use these kinds of tools and how to best leverage content and create content in a way that has a positive impact on your various constituencies.
And the one thing that hasn't changed from my perspective is that fundamentally in healthcare, there's an altruistic mindset. This isn't Coke versus Pepsi. We're here to serve the patients, to help the patients, and to provide an opportunity for them to help themselves. And so I think if we can come alongside them and be a resource and recognize that we're all really in this together, and there's plenty of work to be done. So let's figure out ways that we can, through our collaborative efforts, accomplish the greater good.
Right. So, Lee, I'm going to leave you with one last question, and that is this. We've talked about an evolution of tools and content and approaches over time. So I'm going to ask you, what would you think if you woke up tomorrow and found yourself 5 years in the future? What would you expect to see in terms of changes? What is one thing in healthcare that you would hope to see has changed drastically?
I think as we've seen the technology change, and as people already, there's been so much more ease of people being familiar with using live video and interactive video. I really think that the telemedicine is going to evolve, and 5 years from now, that we're going to see a lot more patient to physician and more patient to provider telemedicine. Whereas a lot of the telemedicine we see now, and even across state lines, a lot of the telemedicine we see now is one doctor talking to another doctor about the patient who's with them, instead of it being patient to doctor. I think we're going to see reforms in the across state line practice of medicine, as well as the opportunity for billing, in a way that it will feel more like legitimate work and medical practice. We always say now that we're not practicing medicine in social media, and that's true. We're not doing that. We're doing education. I'm hopeful that 5 years from now we will see more of that. That technology will make it more easy and convenient for for much more focused real practice of medicine through not necessarily through a social networking platform, but through the digital technology.
Well, you heard it here first, folks. Thank you, Lee. I appreciate very much your taking the time to speak with us today. This is David Harlow. I've been talking with Lee Acey. He is at Lee Acey on Twitter. That's LEEAASE. You should follow him on Twitter. And the social media.mayoclinic.org is the URL for the Center for Social Media. And I am pleased to have had the opportunity to speak with you today. Thank you.
Thanks, David. I've enjoyed it, and appreciate all the work that you've done over the years, and look forward to working in the future.
Thank you. You have been listening to Harlow on Healthcare. I invite you to join us at healthcarenowradio.com. Let's keep the conversation going as we build the future of healthcare at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.